Stage, Mark Addicks.
Hello. So, we've got a great afternoon planned for you, leading with a terrific lunch. And I want to kick it off. Thank you for coming back and for being so prompt. I want to introduce our next speaker, and I want to say a few words really quickly. We have been so pleased to have Walmart as a founding partner here. And in true Walmart fashion, I want to give a shout out to very back. You will notice there are Walmart pharmacy people here who do just what they do every day with real consumers. You can sometime during Manova go back, get your health checkup. They will actually do a quick health checkup for you. They will also give you a flu shot. So last night I was with somebody who said, I need to get a flu shot. And I said, don't worry, you can get one at Manova. So definitely check them out. It's first class, and it's just what the consumer sees every day at Walmart. So thank you to those guys. Walmart is a founding sponsor, and a lot of people don't know, but I think what you're going to hear is what a trailblazer in health Walmart is today. They literally touch 140 plus million people every week through their stores. And they have a vision for health. And that's why we are so excited to have Lori Fleece, who's about to come out. Let me tell you a little bit about her. Here's what I think you really want to know about her. She has a good history as a corporate strategist. She worked for Bain for many years. She came over to Walmart as their head of strategy most recently. And then she has taken over as head of health and wellness. Today she is managing and leading health and wellness for Sam's Club. And as you'll notice in her kind of information, that she's head of store number 8. If you don't know, that's their incubator store. That's their innovation store. And everything they're rapidly doing and rapidly changing happens at store number 8. So it is the place to be. So without further ado, I'd love you to give a great Manova welcome to a real trailblazer in health. And a thank you to Walmart for being our founding sponsor. Let me introduce Lori Fleece.
Thank you, Mark. Thanks so much. How's the morning session going so far? Good. Well, we're very proud at Walmart to be a founding sponsor at Manova, the Manova Health Summit this year. And some of you are probably thinking, Walmart sponsoring a health summit. Some would not believe that we would be that interested in healthcare, but it actually is one of our top priorities, and I want to talk a little bit about why. If I have slides up, great. Go back one. Okay. There are 3 main reasons why, and generically, these are as generic as you can make them, but I want to put a little bit more detail behind them. First of all, health is very important to our customers. As Mark mentioned, in the United States alone, we have 140 million people coming into our stores every week. We also have 100 million people coming to our online digital sites every month. And when you look globally, those numbers expand in total to 270 million customers that we touch on a weekly basis. In the United States, when you ask Americans what their number one concern is, it's healthcare. And it has been and continues to be healthcare for many years. When you ask them what their number one concern is regarding healthcare, it's about the cost of healthcare, the cost of their medication, the cost of provider services, and the cost of their insurance. But when you dig below the averages, what you find is access and quality is also a major concern to about 67% of American households. Those households are either in suburbs or rural areas where access to necessary care is not as good as in urban areas, and for households under $75,000 a year of income. Now, when you think about Walmart and who we serve America. 67% of households in those demographics are our core shoppers. So when our customers tell us they're concerned about health, the cost of health, and access of good health care services, we believe we have a responsibility to do more. Then as it comes to our associates, Walmart is the largest private employer, the largest employer after the Chinese Department of Defense and the US Department of Defense. So we hire 2.2 million people. We have 2.2 million associates worldwide and 1.5 million in the US alone. So when you think about our P&L, the cost of health and wellness of our associates is the second single largest line item in our P&L after wages themselves. So it's really important to us to keep our associates engaged and healthy because that will drive productivity in our business. And then the last for our shareholders. Walmart is the #1 grocer in the US and in the world. In fact, how many of you knew that our single largest selling SKU is a banana? Most people are surprised. We sell more bananas than anything else, globally and in the US. In fact, we sell 1.5 billion pounds of bananas a year. It's amazing, the kind of impact and reach that we have. So health is a big part of our business through groceries, but we've also been in the healthcare services business for over 40 years, starting in pharmacy. And we know that customers who shop us in fresh produce and in pharmacy or other healthcare related services with us, they end up buying more with us and they end up coming more frequently. Those economics work for our business. And as we look at where consumer spending is going to go over the next 5 years, we know two things. One, healthcare cost out of pocket for our customers in dollars is going to go by 3 times more than what they'll spend in retail. So if we can help them save money in healthcare, we can also allow them to spend more in retail. So these are the things that drive us to be interested in healthcare. Our customers need help, our associates need and want to be healthy, and it's good for our business. So what's required? And Mark touched on some of this earlier. We believe that there are several ingredients that come together to fix a puzzle that will improve health in this country. One is we need to make it more affordable. We need to make it more accessible. That's tying to what our customers are telling us. We also need to make it more transparent and more personalized. So we've been known for the first two, affordability and accessibility, but we've been working across all 4 to better serve our customers and to better serve our associates. So I'll give you a flavor for some of the things that we're doing and have been doing. On affordability, in 2006, Walmart disrupted the pharmacy market by coming out with a $4 generic program. What was interesting is we captured significant share, but we did this not by taking customers away from competitors. We did it by growing the market. In fact, there are many videos of testimonials of our customers where you have an individual that says, I can now afford to buy the prescription for myself and my wife. We no longer have to cut the pill in half. This is a dramatic change that happened in pharmacy starting in 2006, and it continues today. Walmart still has a $4 program in which over 200 medications are included in that. And then Sam's Club, our wholesale business, has a free $4 and $10 program for Plus members that covers over 700 medications. That's about bringing affordability in healthcare when our customers need it. Second, food is a big driver of health. And we are always everyday low price, or EDLP, on food. We have been making a big push in organics. When you are at the scale of Walmart and Sam's Club in 5,300 locations, you have to make sure you have a supply chain that can supply the products you have. And we have been focused on that with organics, bringing out new private label organic products and baby products as well. Third, we have a high quality private brands in over-the-counter and vitamins and supplements. These come at least 30% value over the name brands. Brands like Equate and over-the-counter medication, Rely On for diabetes supplies, Spring Valley for vitamins and supplements, and then Great Value and Members Mark across the full food and consumables line. That allows us to really bring the scale of Walmart and provide lower price products with the same or higher quality. We heard a story recently from a pharmacist who was applying for a role at Sam's Club, say that he would get frustrated. he worked for a competitor pharmacy. He would get frustrated at the number of people who would come in and ask him where they could find Equate products. And obviously didn't know that the Equate is a Walmart private brand. The last thing around affordability is making sure our associates have the right care. We offer health plans, health benefits as low as $26 per pay period for our full and part-time associates who are working at least 30 hours a week. That includes many preventative care services that are covered 100%, as well as new telehealth benefits. For all of our associates, we offer parental leave, best-in-class parental leave benefits, as well as very effective wellness programs, which I'll touch on later. So overall, affordability is a sweet spot of Walmart. Accessibility is another piece of the puzzle for us that makes sense. We have roughly 5,300 locations, and 90% of the population lives within 10 miles of one of our locations. That allows us to give our customers the broadest assortment of healthcare products and services possible. And we're expanding the healthcare services. Today, we have nearly 5,300 pharmacies in which you can which dispense medication, but also do many clinical services like health screenings, like immunizations that Mark commented there in the back, but also other things like glucose and cholesterol testing in 30 states that allow it. This allows us to really make those services convenient for customers, given our hours and our location. We also have 3,800 vision centers that offer eye exams and low-cost eyewear, both contact lenses and glasses. In fact, at Sam's Club, you can get a pair of glasses in a branded frame for $59, as low as $59, that have anti-reflective coating at the top of the line for free. There are also a number of partnerships that we're working on, and you'll see them in many different markets, and other initiatives that we've rolled out. Care clinics in several of our stores. We have a partnership with Quest, bringing lab and diagnostic services to the local communities we operate. We're piloting with partners in dental services, and we have a partnership with Healthcare Begins Here to ensure that people have education around their insurance options. But just like the people that are in the back providing immunizations and health screenings, we, since 2014, have been providing free wellness days at both Walmart and Sam's that offer low-cost immunizations and a free health screening. Over 3 million customers have participated in one of these health screenings since we began in 2014. For some individuals, we actually caught a life-threatening issue, and for many others, more than you would believe, we actually diagnosed chronic diseases that were yet to be diagnosed, like diabetes. This really allows people to engage in their own health and to make their lives better. On transparency, the focus here is around making sure that people understand the quality of care and the cost of care. For our associates, we've employed many partnerships and tools, such as with Ground Rounds, to provide provider recommendations to our associates, as well as ensure they have cost transparency for the kind of medical procedures that they will want. We also have been very progressive in contracting directly with providers. Let me give you a reason and some stats why. In one market, using our sample size of employees, which is a sizable number, we found in one market alone there was an 800% difference in the instance of C-section deliveries. Now, I can tell you the cost and the risk that is put on the patient for an unnecessary C-section is incredibly high. And so making sure that we have our associates work with the providers that are going to provide them the best care, the lowest risk, the best outcomes, will get to the lowest cost. In addition, since we put in place our Center of Excellence on spinal surgery, we have found that over 50% of spinal surgery recommendations have actually not been necessary. These type of intensive and intrusive surgeries present huge risk to the patient. And if there are alternatives that are just as effective or more, that is the route that most of our associates want to pursue. And today we have over 9 areas covered by what we call our Centers of Excellence with partners. In addition to what we do for our associates, we're trying to increase cost and other transparency that drive health. So obviously, everyday low price is a way that we're transparent. There's no gimmicks. You always get the low price at Walmart. You don't have to be there on a Tuesday or within a certain window in the calendar. The other things that we're doing is we're trying to improve food safety and tracking our product all the way back to the farms. For example, in the last month, we started rolling out for leafy vegetables and produce that we sell in Walmart, a blockchain solution that allows us to go all the way back to the farm in which they were farmed. That allows us to quickly understand if there are any food safety issues. We can quickly identify the parts of our supply that need to get pulled and removed from consumer offer. And then on ingredient transparency, since 2011, the Walmart Foundation and Walmart has been working to remove artificial and other unnecessary ingredients from all of our private brands. And then the fourth piece of the puzzle is around personalization. No two health journeys are alike, and we aspire to create programs to help each of our associates and each of our customers live better. And at our scale, that can be challenging. But the one program I'm really proud of is called ZP. ZP stands for Zero Pressure. And it's a program that we started 6 years ago at Walmart, and it was a paper-based program to help associates and their family and friends achieve their fitness, food, family, and financial goals with zero pressure, just taking one day and making it better than the day before. Thus far, we've had over 2 million participants in this program. And when you look at some of the results, we've had more people lose 100 pounds or more and keep it off than all of the seasons of the America's Biggest Loser. It is truly amazing how when you engage folks, give them the tools, and put a community around them, the kind of impact that you can have. And that's what we're finding with ZP. We also have been pursuing a number of partnerships with companies like ShareCare and Fresh Try, where we're bringing more tools to our associates and to the ZP participants such that they can tailor the support that they need to their individual case, because not every solution works for every individual. It's a combination of things, as all of you know. And the last part around personalization is educating people. Our foundation set a goal of educating 4 million people by the year 2020 on nutrition. Having people understand the nutritional value can lead to better health. And so far, we've educated 3.5 million, and so are very much on track to hit our goal. So what have we learned? We've learned 4 things. One, that our customers want and need Walmart. When we did a survey over a year ago to actually look at households in America and adults in America and ask them whether or not they would value healthcare services and products from Walmart, and over 50% of them said they would highly consider. Now, marketing studies are marketing studies, and it really, they say they want it, but until you actually put it in the market, you actually don't know whether or not they will. The reality is in the initiatives that we've been rolling out over the past 2 to 3 years, the response has been overwhelming and overwhelmingly positive. And so we know that our customers need and want a solution, and we think that our brand stands for affordability and access, and therefore it's resonating. Second is incentive alignment is key. We've learned this in our centers of excellence, really aligning the associate and the provider in making choices around pretty significant procedures, from, like we said, spinal surgery. It could be knee and hip replacement surgery. It could be cancer, specific cancer therapies. Really aligning incentives will drive better outcomes, better health, and lower cost. But also we've done a number of commercial programs with health plans where we take our access to fresh food and healthy food and the plan's understanding of its members and those that may be pre-diabetic, and actually tailoring a set of incentives to actually incent folks to eat better and delay the onset of diabetes. These kind of programs have shown results, and our partners continue to use them for the members that make sense. The third is that technology will be a critical enabler, but it won't be the only answer. It will require trust and data in order to be personalized, but there will be a human dimension. ZP is a great example of this, and my colleague David Hoke will present this tomorrow afternoon in the Global Trends and Initiatives section. And then the last one, and this is true for Walmart, partnerships are required, and they're an essential part of the strategy to lower the cost of healthcare and to improve the health of the country. If you take the expertise that lies in the industry and you combine it with Walmart's footprint, it really is an opportunity to have a positive impact at scale. So what's next? We're going to continue to test and learn. We're doing a lot in testing and learning what customers want and what actually works. I'll give you an analogy of what we did on online grocery. We rolled out online grocery in 2013, and we did it in 2 different locations, San Francisco and Denver. And we really didn't know how it was going to work. These were complete incubator tests. We spent time on those and figured out what our recipe for success would be. And in 2015, we rolled out in 5 markets. As soon as we figured out the magic and our NPS, our customer net promoter score, had reached unprecedented high levels, higher than any retailer in the industry across retail, not grocery, but retail in general. We then decided to roll out to 100 markets. And by 2017, we'd rolled out to 1,000 markets within the US, and by the end of 2018, we'll be in 2,000. The reality is with Walmart is you have to test and learn, and there are many things that will work and many things that won't, and figuring out what will work or what doesn't work and how to iterate to make it work then, and then scaling it as fast as possible is really our plan. We'll focus on 2 priorities. One is we have to drive better health outcomes. Just providing services is not enough. You have to measure yourself by the outcomes, and that requires accessible, affordable, high-quality products and services. And we also will be measuring our customer experience, using Net Promoter Score as a way to really ensure that we're delivering a consistently strong customer experience in healthcare. When we step back and reflect on our purpose, which is to save people money so we can live better, so they can live better, for us, there is no better area today than health and wellness to deliver on Sam Walton's initial vision and our purpose: save money and live better. Thank you.